Hi, everybody, and welcome to Trendlines, a podcast on global affairs brought to you by World Politics Review. I'm Judah Grunstein, WPR's editor-in-chief, and I'm joined by WPR managing editor, Freddy Deknatel. Hi, Freddy.
Hey, Judah.
We'll be talking about an increasingly prominent feature of the COVID-19 pandemic, the role of data, disinformation, propaganda, and public diplomacy. Before we get started, just a quick reminder for everyone listening that the interview episode of the podcast went live Wednesday. Elliot spoke with Abraham Denmark about a recently unveiled plan to restructure the U.S. Marine Corps so it can better counter China's advanced military capabilities in the Asia Pacific. Freddy, getting to today's topic, I'm personally very much a narrative-driven person when it comes to what engages me in international affairs, what engages me in terms of international affairs stories. One thing that's become very clear about the COVID-19 pandemic is that it is a very data-driven story. I feel like all of us over the course of the last few weeks to months have become very fluent in monitoring graphs and curves, cases of the disease, cases per million among countries. In a more macabre development more recently, deaths and deaths per million. All of this in an attempt to determine whether or not we're flattening the curve of the outbreak right now. But in any case, it seems like everyone is focused on data.
Yeah, there's a chart in particular that the Financial Times has been publishing, I think daily, in a kind of running story about updates from the pandemic around the world that charts the rate of growth in different countries and the related number of deaths as well. And I've sort of seen that as one of the, at least according to Twitter, it seems, one of the more popular sort of metrics that people are following, because it puts this all in a easy to see graph in terms of, well, the U.S. is this far along in terms of its growing number of cases relative to Italy at this time, or even China. And it's a way that, it does seem to put a lot of these figures in digestible terms, and you can come up with a handful of other examples just in terms of the numbers of cases themselves, the numbers of testing. I think that the sort of challenge of even just getting our minds around daily what is happening, let alone covering it, writing about it, is, on the one hand, the numbers seem irrefutable in a sense that these are discrete, concrete figures. There are X number of cases. They've grown by this amount over some period of time. But the other side of this story is that not questioning the reliability of those figures, but wondering, all the other figures that they don't reveal. I mean, in the U.S., for example, we know that the government has been weeks and weeks behind in terms of testing, and that even with the huge number of cases in the U.S. now, it's probably likely many more than that. Same thing in China now, where even though the worst of the outbreak there seems to have passed, there's increasing reporting that China was downplaying the number of its cases all along. Getting back to that FT chart, Japan has had very low numbers of cases apparently, which has been one story about what have they been doing better than other countries since their first cases came before the U.S., but I believe before the U.S., but have not exploded anything like we've seen here in the U.S. And yet now there's more question about how reliable were those figures all along? Was Japan under-reporting or under-testing? So it's this challenge in terms of all we have are these figures to go off of, and certainly most of them are very reliable, but there is this question of how much control governments have over them in particular, and especially in cases where there isn't much trust in government, or in the case of China or other countries where the authorities they have all the levers of power, and it's not in their interest to reveal just how bad things are. It does raise a lot of questions about the figures and what they don't reveal.
So to parse it out a little bit, in terms of accuracy of the data, there's this first category where there are unintentional or unavoidable inaccuracies. So, for instance, again, as part of that fluency, I think we all of us who are following this very, very closely have a sense of which countries are doing massive testing, like Germany. Iceland is another one I've seen mentioned, even though its population is very small. Other countries, because of limitations on their testing capacity, are only testing people who present to hospitals with grave symptoms. So it's almost like confirmation testing, but it leaves out all the people who are either asymptomatic or who have been denied testing because their symptoms are not grave enough. So in some ways, these are the unintentional inaccuracies. And then when it comes to deaths, for instance, there are people who have died at home rather than in hospitals who hadn't been counted in the UK, for instance, until recently. Then I've been reading about people who have died in the hospital, but and with symptoms that would suggest COVID-19, but because they hadn't been tested or confirmed tested, or sometimes tested and tested negative, and I've read that there's an increasing problem with false negatives, they are not counted. And so I think in terms of inaccuracies there, those are unintentional or unavoidable. Then you already mentioned, you get into this second category of intentional inaccuracies. To begin with, there are these accusations that China has been covering up and underreporting. More recently, they admitted that they hadn't been counting asymptomatic people, but who had tested positive. There was a lot of accusations about Iran, for instance, both in terms of lack of testing capacity, but also officially denying that there was a problem. And then another category, I think, which I'd call denialism. It's maybe not intentional inaccuracy as much as a psychological or a psychologically driven inaccuracy. But I'm thinking of people like Brazilian President Jair Bolsonaro, various U.S. governors, and as well as some religious sects and fundamentalists, where the severity and the gravity of the situation is being denied. And then for me, you have this sort of unique category, which is U.S. President Donald Trump, where it's hard to parse which are politically convenient and intentional inaccuracies, how much is denialism, how much is a defensiveness to try to avoid being pinned for blame. But clearly, there have been a lot of he's engaged in a lot of inaccuracies, to the extent that there have been calls, and some of the major news networks have even followed through on avoiding televising his remarks from the nightly press conferences these days, in favor of the medical experts who follow him on the dais. But to my mind, that's the sort of the taxonomy of the inaccuracies that we've seen so far to date.
Yeah, it's a good way of breaking it down. And some of this stuff is expected in a massive public health crisis, where even in the countries that were well prepared, there are still, just in terms of the scale of the problem, mistakes will be made. There will be sort of a catch up to whether getting testing right, making sure the tests are accurate, testing everybody so you can have an accurate picture. But then I think that what is ultimately more revealing and more troubling, as we're just realizing the scale of the pandemic, are the sort of latter two categories. On the one hand, countries like China that have an interest in suppressing data and information. There have been some cases as well that seem almost ridiculous. Turkmenistan apparently has banned the use of the word coronavirus. I'm not sure exactly how they're going to enforce it, but it's this idea that the virus doesn't exist if you can't even say the word.
It's been proven as an effective strategy.
Exactly, but the that, and then again, even those responses in a sort of authoritarian contexts are not unexpected, I guess. This is how a lot of crises are dealt with in places like that. Governments keep information hidden. They have a control over narratives. What's very different, and what I think is ultimately the most troubling, especially not just because I'm here in the U.S., but because this was the week that the U.S. government really sort of kind of came clean about the numbers and is admitting that, based on their projections, 100 to 200,000 deaths is now likely.
And would be considered not a worst case scenario, if not a best case scenario, but a relatively favorable outcome.
Exactly, and that's what's surreal, jarring, staggering. There's different ways to describe it, but the fact that Trump has been so inconsistent about being honest and trustworthy in not just describing the pandemic itself, but specifically the numbers. And early on, he was latched on to the apparently low numbers of cases and didn't even want to allow a cruise ship to dock in California because he wanted to, artificially keep the numbers of cases low. So he was very much engaged in trying to manipulate the figures in a very sort of blatant way. And then now, sort of the ease with which he's turned around, and he obviously did it because the writing's on the wall, effectively, and public health experts obviously got through to him on some level. But hearing him, of all people, now stand in front of a PowerPoint slide and try to come clean about the fact that 100 to 200,000 people will die, and that would be a job well done, given that it could have been much worse, is just staggering. And again, it comes back to this question of numbers and figures. And you can only, at least for me, that my reaction partly there is, there was such a focus on the figures when they were very low, and now they're almost trying to downplay the figures as they've just gotten exponentially larger. And it's further proof that you can't really trust what they're saying as a messenger, but also that, it's never been about just giving the information and keeping Americans up to date. It's a much more political agenda.
I'd add there are a couple particularities about this virus, and then a generality about human nature. The virus itself is maddening because, unlike other novel coronaviruses like the SARS and MERS, for instance, it doesn't really behave in a standard uniform way in the various people that it infects. So, as an example, I had a head cold this weekend, and for 2-3 days I was just monitoring everything. Because there's so many different ranges of symptoms that I've read about being reported, and and not only that, but it's increasingly believed that a significant amount, proportion of people infected don't even have any symptoms. But then they're discovering each week different pathways and different organ systems that the virus can target, which explains sometimes why the symptoms are as varied. Again, there is a core set of primary symptoms that people should be aware of and vigilant about. But at the same time, between this sort of mysterious way in which the virus attacks different each individual differently, the fact that there are so many asymptomatic carriers makes it extremely hard to have accurate data, even in a best case scenario where there was massive testing available and massive testing done and a very immediate government response. I guess the second thing about government response and data in general is the degree to which sometimes human nature can be hermetically sealed against data. And that could be when narrative actually trumps data. And we saw it across Europe, country by country, and then in the U.S., and now within the U.S., state by state, where the objective reality being portrayed every night on the news, and for us all day long through the news wires we read and the reporting we read, made it very clear. There's something very difficult about getting a clear take on this virus because, as I'm sure most people listening have already heard before, what we're seeing today actually happened 2-3 weeks ago, right? So the numbers and the data that the tip of the iceberg in terms of data that has cleared the surface now actually started under the surface 2-3 weeks ago. And so when you have human nature that generally wants to put off having to deal with a crisis as long as is possible, and we see that with the climate crisis, for instance, and even in this case where it's not here yet, so we don't have to do the things that other places are doing that would be effective. And then the second part of that is that even when it became clear that it would be necessary, for instance, in France, when there was the emergence of the crisis and hospitals were beginning to be overrun, you had the government strongly suggest staying home. Same thing happened here in the UK a couple weeks later. And that weekend there was really nice sunny weather and everyone flocked to the parks and went outside. They banned soccer matches, they banned the public attendance of soccer matches. So you had the Paris Football Club playing a match in an empty stadium, and all of the fans gathered in a crowd around the stadium. Again, so within 3 days or 3 days, the government had to actually enforce a legal enforcement of the confinement measures because people just weren't taking it seriously. So in terms of the data and the accuracy, even where we've had accurate data, that doesn't necessarily mean that it will guide human behavior.
No, I think it's a lesson. On the one hand it's partly specific to the U.S. in some instances, but, I know it's not exclusive either in terms of where people get their news and how that news is being delivered. Certainly, the most egregious example here in the U.S. was Fox News, which was downplaying the pandemic for weeks, if not months, and then has sort of very quickly tried to shift its tone to take it more seriously, but also try to deflect blame, and still carry water for Donald Trump. But it's really been a shocking example of how dangerous it can be when you have media that is manipulating and not simply reporting information as it is. And I think that there's already been indications that Fox might be in legal trouble because viewers could sue them for being misinformed about the scale of this crisis, because there were people on TV saying saying that this is a hoax, or saying that it's just the flu, deliberately downplaying the threat,
encouraging people to engage in unsafe behavior like attending public gatherings and restaurants and things like that.
Yeah, exactly. And then so there's that, but then also even for, as you're saying, people who just maybe listen to the news on the radio or just get a brief news update, or are not, news consumers watching cable news for hours, but just getting news in sound bites and headlines. Even, the more sober, just direct information about there were this number of cases in China and it's been growing for this period of time, and now it's in Italy, and now Italy is, dealing with hundreds of deaths every day, and that it's coming to other countries, and there isn't really a way to insulate yourself. You have to prepare through other ways that, whether because of human nature or because governments just didn't take it seriously enough or were in denial about the risk. This is this unusual circumstance where it isn't like 9/11 or some other terrorist attack where it seemingly came out of nowhere, even though, we know after the fact there were warnings and it wasn't a complete, black swan event necessarily. But this in its own way is very different because, the world, depending on which part of the world you're in, you've seen what's happened, a week or 2 weeks or even a month before. And now it's probably just starting if it hasn't already started where you are. And that's true in parts of Europe and the US and many other places. So it is this confusing situation where, reality is sort of, you get a glimpse at the future, and there really isn't any question about it. I mean, the figures are there. You know exactly what the number of cases look like, what the mortality rates look like, even if there obviously are some variations from country to country depending on healthcare systems and different circumstances. But in terms of the numbers and the reality, people sort of know what's coming, and yet they're still not preparing.
As a little aside too, I'll admit that we've been covering this since late January, and it took me a while to really appreciate that this wasn't a story about something in China. And I think part of that had to do with some of the warnings that we've had in the past, whether it was the SARS outbreak in 2002, I believe, and then there was the swine flu in 2009, at which time I was already working with WPR, and I remember covering that and covering global health in the context of the swine flu. And then the most recent being the MERS outbreak in 2015. And each one was very alarming, but it was largely contained and ended up, whether through public health measures or through the nature of the virus itself, not becoming the worst case scenario that people were worried about. As a side note, interestingly enough, South Korea, for instance, which has been lauded for its response to this pandemic, in 2015 was heavily criticized for what was considered a failure in its response to the MERS outbreak there. And so they learned from that failure very obviously in the meantime. So in some ways, it almost takes a failure for a country to really take things seriously. But other countries were probably lulled into a certain sense of false security by the fact that those previous warnings and alarms didn't turn out to be as bad as people anticipated or feared. I guess with regard to, you mentioned Fox News, getting back to this question of data and inaccuracies, that gets us into this question of disinformation, which is not just an intentional inaccuracy, but it's a weaponized intentional inaccuracy. I'm not sure the degree to which Fox newscasters and anchors were aware of their inaccuracies. But more recently, we have China, for instance, floating false narratives about the origin of the virus, blaming the U.S. military for the spread of the virus in Wuhan. And then as well, more informally, outside of government channels, or potentially not outside of government channels, when I click through, for instance, on Twitter for some of the people that I follow, epidemiologists, public health officials, things like that, almost uniformly, the first comment after, for instance, a very informative thread or anything is very clearly a bot or a troll contesting the information or saying coronavirus is a hoax and saying that it's a media hoax and things like that. And it's possible and probable that those bot networks are the work of government channels. Russia is obviously a country that is known to use them, China possibly as well. But in any case, this question of disinformation and weaponizing disinformation when it comes to the pandemic for national gain and reasons of strategic competition.
We've seen this emerging propaganda war over the response to the pandemic, some of which is deliberate disinformation, some of which is governments deploying their own sort of selective narratives. This is something that a couple of our columnists have written about recently, and which you touched on also in your column this week. And on the one hand, China has been pushing the most egregious sort of version of this propaganda, is what you mentioned, the idea that pushed by some officials in China that COVID-19 was, some U.S. military biological weapon, essentially, brought to China by the U.S. Army. Coincidentally or not, there's also been, I think it was being made more than a month and a half, 2 months ago, but from some more far right wing of the Republican Party. I think Senator Tom Cotton in particular suggested early on that when the outbreak was still really in China, that this was a biological weapon that China had developed. And there was just this, basically conspiracy theory, but it got more credibility because a Republican senator was on Fox News talking about it, that the virus was sort of a Chinese biological weapon gone wrong. And so we've seen these, from government officials, no less, propaganda about the pandemic, about its origins, about who is effectively to blame for its spread. And then obviously, online on social media, we can't trace who it's really coming from, but there's a whole nother galaxy of disinformation, whether that's people just, bots that are just designed to refute even the most basic news and updates about COVID-19 to more deliberate and sort of engaged strategies that really kind of have a lot to do with a lot of the political misinformation, disinformation that we've seen on social media for several years now, whether that's pushing a specific political party or agenda, or just trying to spread disinformation so no one really knows what to believe. What's sort of shocking to me is that, if some of those are, for example, Russian bots or other countries that have an interest in seeing, in particular, the U.S. In sowing political division in the U.S., you sort of have to wonder, well, how much good is that going to do right now? Because again, it's a global pandemic. A country like Russia, despite its best efforts to claim that it has the virus under control there, the cases are also spreading in Russia. That's another example of an authoritarian state that has tried to limit what the public can really know about the pandemic.
Vladimir Putin is apparently holed up in his dock on the Black Sea, or outside of Moscow, I think. Not necessarily in seclusion, but I think he's social distancing. But yeah, it's this question. There was some suggestion early on about countries like Russia, perhaps even China, Iran, becoming strategically opportunistic with the United States in disarray domestically because of the spread of the virus, maybe probing, testing, an aggressive move against Taiwan, for instance, or Russia, an aggressive move in Eastern Europe. But more recently, it's become clear, as you said, that what's happening in the U.S. today is going to be happening elsewhere 2-3 weeks from now. And it is now spreading in Russia after a period in which, again, the initial period of this epidemic allows governments to be in denial and to think that it's still not their problem. They're very quickly disabused of that illusion. I guess the final category before we move on that might be interesting to mention is the public diplomacy messaging. So the use of public diplomacy to frame data, information, and narrative. Some of the more recent examples that I've seen are, for instance, some of the medical equipment that was sent from China to Italy that China sort of trumpeted as being donated and humanitarian donations, and Italy made a point of making it clear that a lot of it, if not all of it, was purchased rather than donated. Something similar happened. A plane load or two of medical equipment just left Russia for the United States. Russia's foreign ministry or the office of the president, I'm not sure which, but a spokesperson for Russia described it as humanitarian aid that was donated, and the U.S. State Department State Department declared or announced that a plane load of purchased medical supplies was on its way. And then more recently, we've seen this question of naming the virus, Trump calling it the China virus, and Secretary of State Mike Pompeo calling it the Wuhan virus, both of which have resolved back to coronavirus since Trump spoke with President Xi Jinping on the phone earlier this week, I believe it was. But this whole use of if not both the national responses to the outbreak, and also the ways in which countries are either providing aid or selling aid to other countries, is another element of information and data that's being exploited, if not manipulated, by various countries.
Yeah, I mean, we've seen it on the one hand, with Trump's inconsistency going back and forth between one day deciding that he's going to continue calling it the Chinese virus and effectively blame China for this pandemic, and then more recently, saying that he had a productive conversation with Xi Jinping. He'll probably go back and forth a few more times in the next couple of days. The other interesting part about the public diplomacy thing is that there's been there was some misreporting. Again, part of the this is also part of the disinformation aspect, that there were some supplies that the State Department had donated to other countries, I believe, and there was it was being covered in conservative media as that this was a bad thing, that the U.S. was effectively giving away medical supplies to other countries as foreign aid at a time when the U.S. stockpile is low. It turned out that wasn't obviously the story, but I do think that what we're seeing in terms of the question of countries helping each other or not, which is something we talked about in a previous podcast, and has also come up in a handful of pieces recently on the site about what does international cooperation look like during a pandemic like this. We're seeing a backlash against certain countries, at least in certain countries, against helping another country out, because there's this shortage of medical supplies, there's a shortage of masks, ventilators, all this other equipment, and countries are competing with each other since supply chains have shut down. And I think we see that manifest in public diplomacy, where certain countries like China are trying to make a big show out of donating equipment, even though, as you said, in cases like Italy and other places, they bought that equipment from China. But then in other cases, the U.S. government, the Trump administration, I think just this week said that they would put a freeze on any foreign aid in term that would, medical equipment and the like, amid the pandemic. So I think that there's different kinds of messaging going around, and none of it good.
You mentioned something about a report that went out that subsequently proved to not be true. I just this morning saw he's no longer very prominent, but he used to be pretty prominent French politician demanding why the private clinics and private hospitals in Paris hadn't been requisitioned as part of the response, and making it seem like there were all these empty beds and staff that wasn't busy doing anything, when in fact I believe 3 or 4 days earlier, if not longer, those hospitals and private clinics. France has a very strong public health system, but they also, in addition, have private hospitals and private clinics. Those private clinics and private hospitals had made themselves available to the public health system as part of the response. And so you had a very prominent case of someone who should be very well informed going on news reporting that was maybe dated or misinforming him. And I think what it all really underscores, our entire discussion, is the importance at a time like this of every individual having a very developed media and information literacy and hygiene, in a sense, that there's a need for information hygiene in addition to public health hygiene, because at a time like this, every piece of misinformation or inaccurate information can be deadly. To be blunt about it, but in any case, this is a time that underscores it in a way that we've seen over the past few years in the U.S. and elsewhere, where you have these media spheres that are sort of built on a partisan divide, and different narratives in different spheres. This is an event and a crisis and an emergency where you see the real costs of that, and you see the real costs of I think what we can call the deterioration of information literacy at a time when information has become ubiquitous. So has misinformation, essentially. All right, time to mention a couple WPR articles for everyone listening. Freddy, what did you have in mind?
In non-pandemic news, a briefing by Michael Semple on the state of peace talks in Afghanistan and why internal divisions, both within the Afghan government itself, where there are two rival politicians claiming the presidency, and within the Taliban, are hindering peace talks. I thought it was particularly interesting how Michael points out that within the Taliban, there's a divide between the movement's political leaders, many of whom are based in Pakistan, not in Afghanistan, and then the military wing that's fighting on the ground in Afghanistan, and how they're still not on the same page.
A great expert and a great writer, and who also happens to have very, very deep contacts from having studied Afghanistan and all the various political movements and militias there for years. It's always a pleasure to have Michael in WPR. And I'll mention Matthew Gibney's in-depth article this week on the impact of the 2015 European migrant crisis on international norms for refugees. As Matthew explains, there was some good to come out of the crisis. In particular, it was the catalyst for the UN-sponsored Global Compact on Refugees, which was ratified in 2018 and included key objectives for easing pressure on refugee host countries, enhancing self-reliance for refugees, and other measures to improve their conditions. But the crisis also introduced a number of practices mainly centered around exclusion that have significantly undermined international norms. As Matthew writes, quote, "Since 2015, many wealthy and developed nations have steadily intensified their efforts to repel and deter asylum seekers in violation of even the most basic commitments to refugees under international law." It's a sobering piece and one that remains relevant 5 years after the crisis. All right, two things I want to mention before we get to the Who Said That segment. First, if you'd like to stay up to date on everything we cover at WPR, go ahead and sign up for our free daily newsletter at wpr.pub/trendlines. In addition to free access to selected WPR articles all week long, you'll also get a promotional code for a 25% discount on a WPR subscription. Again, the URL is wpr.pub/trendlines. And second, if you'd like to drop us a line with questions or comments, you can email us at podcast@worldpoliticsreview.com. All right, time for Who Said That? Freddy, what do you got for me?
All right, the quote includes a nationality, so I'm going to take that out. Here's the quote. "God is this nationality. The cure is right there."
Wow. That could be so many places around the world. I have no idea.
God is Brazilian.
Oh.
This was Jair Bolsonaro, the far-right president of Brazil, who is one of the more egregious examples of a leader around the world stubbornly refusing to admit the severity of this pandemic.
I actually had a flash right as you were revealing. I thought, oh, it's Bolsonaro, because from what I understand, he's an evangelical as well, so a very fundamentalist believer. All right, here's mine. I think it'll probably be clear what it's talking about. I guess getting it right will mean who or what it's describing. Here's the quote. "I think they're probably feeling a bit lonely, and they have come down to have a look around."
Oh, that's a good one. I don't know.
That's Carol Maruby, a town councillor of Llandudno, Wales, speaking about a herd of Kashmir goats that have taken advantage of the UK's social distancing restrictions on humans to enjoy the town's empty streets and squares. Lots of photos all over the internet of wildlife and animals reclaiming all the spaces that humans have evacuated over the past few weeks.
One silver lining, I guess.
It might make it harder to go back out when this is all over, though. All right, great stuff, Freddy. Thanks.
Thanks, Judah.
If you'd like to stay up to date on everything we cover at WPR, go ahead and sign up for our daily newsletter at wpr.pub/trendlines. In addition to free access to selected WPR articles all week long, you'll also get a promotional code for a 25% discount on a WPR subscription. And if you'd like to send comments or questions, email us at podcast@worldpoliticsreview.com. Trendlines is produced and edited by Peter Dury. You can follow him and World Politics Review on Twitter, and you can find links to pieces covering the issues we talked about in the show notes on worldpoliticsreview.com. Have a great weekend, and see you next week for 2 new episodes of Trendlines.